During this pandemic, it's been a little bit different than normal. My job has changed a lot. It's just totally changed the way that we care for certain patients. I'm Sophia and I'm with Refinery29. I'm calling in from the state of Florida. I am a registered nurse. I work on a surgical unit. My job is to take care and advocate for patients. I have been a registered nurse since February of last year. My passion in nursing began at the age of 12. My grandfather was unfortunately diagnosed with bladder cancer. I saw his hospice nurse, and she became a huge inspiration to me. The night that he passed away, I just saw how much love she took towards him and made sure that he was comfortable. She was there for our family and never left our side, and we still have that connection with her till this day. I started doing nursing classes and then went to college and started nursing school, and it was just a complete passion of mine.
So I just got to my hospital for my third night this week. It has been a couple of busy nights, so let's head in and see what tonight will bring.
I work night shift, which means I work from 7 p.m. to 7 a.m. Normally we have surgeries every single day. When I came on for my first shift, coming back after a few days off, and the pandemic started to pick up and health professionals were really called to action, I didn't know what I was going to be coming into, what kind of patients I would be taking care of, how many patients I would be getting, how many hours I would be asked to work, what it meant to take care of COVID patients, and what it meant for going home and making sure that I didn't infect my family. Cloth masks that are made from home are not really effective in what's going on right now. It may help with the droplet, so if someone sneezes or coughs, and that happens to be near you, if you are wearing a mask, it does help you. However, it is airborne, so the masks that are most effective are the N95 masks and the N100 masks. They both have filters in them, and that's currently what our healthcare professionals really need. And other hospitals don't even have N95 masks to use, so we are lucky that we even have them currently.
Well, I just finished night 3 out of 4 this week. I am pretty exhausted. That was a long night. I'm tired. I'm ready to go home, take a shower, and hopefully get a few hours of sleep.
Continuing to work is important to me. I have decided to pick up a few extra shifts these upcoming weeks in order to help out my unit so that we don't have a strain on staff. I know that there are patients that need my help. And not only are there patients, but there's families who are counting on the people at the hospital to take care of their loved ones when they're not able to see them every single day. We have no visiting hours currently. This really breaks the connection between a patient and their family, and we are very sorry for the fact that these patients can't have just that face-to-face connection. So a few nurses and a few patient care techs have been teaching them how to FaceTime on their phones and just trying to keep that connection with their families. The greatest thing that I saw was the community came together and they all parked in the parking lot to practice social distancing. And in the parking lot, they flashed their lights, kind of like a Christmas display. So this was just a sign for the healthcare professionals and the patients that the community was with them and thinking of them and keeping them in their thoughts and praying for them. I had a patient who was very lonely and very sad, and I just kind of pulled up a chair next to her bed and just held her hand, and she just kind of talked to me about her day, and that physical touch between her and I seemed to provide her some comfort during this time. Patients seemed to be wanting to talk a lot more, and they're wanting to share their feelings and tell me that they're lonely, and that's very hard to hear as a healthcare worker. It's very important for us right now to be there, to show up at work, to be present, and to make sure that we're providing the best care that we can, and show them that we are calm, to show them that during this time of fear and this time of panic that we are doing our job and we're doing it calmly and we're doing it to the best of our ability. Every nurse's story during this pandemic is different. My story looks different than a nurse in California, a nurse in New York, a nurse in Ohio. We all want to take care of people. We all want to provide the best care We also want to keep our patients and ourselves safe and our other colleagues safe. To be considered on the front lines is an honor. You are dealing with people's families, with patients in their most vulnerable states, and it's not a job that I take lightly. I did not expect to ever be in a pandemic, especially in my first year of nursing. It is a complete whirlwind. It's very stressful, it's very scary, it makes people very anxious. Stay in contact with your friends and family, call them on the phone, FaceTime with them, but make sure that you're practicing social distancing. There are many people who are immunocompromised, so please stay home. If you do see a nurse or a doctor, please thank them for what they're doing. But also, there's just so many workers that are still working right now and that cannot work from home and that are away from their families and possibly being exposed to COVID-19 as well. So please thank them. I don't always feel like a hero because I'm just doing the work that I have always been passionate about, but I feel very blessed to be doing what I love to do. Nursing people back to health is essential. I'm doing my part, so please stay home and do yours. Thank you for watching Refinery29. To watch more videos, click here, and to subscribe, click here.